Hi, I'm David Gandara from the University of California, Davis, where I'm the Director of Thoracic Oncology. To pick up on this issue about the sufficient amount of tumor tissue to do molecular testing, one of the keys to this has been the use of a multidisciplinary team. I think everyone knows about the recent onset of molecular tumor boards, but I can tell you at UC Davis, as well as many other centers, just our typical tumor board or our thoracic tumor board, where we make clinical decisions, has become, in probably a third to one half the cases, a discussion by the multidisciplinary team in who will obtain the biopsy or perhaps the rebiopsy. And what I mean by this is, let's say that a patient has come in and a fine needle aspiration has been done, and the pathologist says, I can tell this is non-small cell lung cancer. Maybe they say it's adenocarcinoma because I did a TTF1 stain and it was positive, but there's insufficient tissue for doing molecular testing. So at our tumor board, we would look at the CT scans, present the case, and we would say, who's going to obtain this biopsy or rebiopsy? Is it going to be the interventional radiologist by a CT-guided approach? Is it going to be pulmonary medicine by maybe EBUS into a lymph node or navigational bronchoscopy for a transbronchial biopsy? Or is this really a situation where we need a surgical biopsy? So the multidisciplinary team, including the pathologists and the radiologists, all of these other disciplines will decide what's the best approach for that particular patient. Just to give you an example, sometimes we have a patient where the disease is primarily in bones. I think most of you know that bony metastases are very difficult in terms of molecular testing because of the decalcification process. So, for example, we might say there is an extension in this bone metastasis out of the bone into the soft tissue. And our interventional radiologist would then go to that extra bony site and obtain the core biopsy for molecular testing. And the pathologist, because they're part of the team, would not decalcify the specimen. So that's one example of how the multidisciplinary team could help with this.